So I'm going to put the first one in the answered so you
Good
can track
day
it.
to you, Tammy.
Oh, hi. I forgot. I was so busy changing the thing.
You
So
want to help people, and so
I
sometimes we
do.
forget just
Yes.
to say hello.
Yes. Yes. Hello, Dr. Rob. Hello, everyone. We're so glad you're
Hi.
joining us live. And if here's the deal, if you are watching this on YouTube, you could join us live. You can join, on Seeking Integrity. You will find a link to join us at 5 p.m. on Pacific time on Monday nights. We welcome that. Then you get to ask your questions in person. No one is seen or heard as you see on these recordings, but you get to ask your questions even as an anonymous attendee. So we would welcome you to join us, whether you're the betrayed partner or the person that's struggling. Sometimes both, you are joining us, and we appreciate that. So Dr. Rob, the first question: if I'm elderly with long time porn issue, why do I need to stop since I can't actually have sex with my partner anyway due to age or whatever induced erectile dysfunction? Do wives sometimes accept the offender under those circumstances, or is it not allowed because we heal, we go through the full process?
Well, let me start with the second issue first, which is that we are not offenders. Sex addicts are not offenders. Porn addicts are not offenders. Sexual offending is defined by non-consensual sex with another person. It's not defined by lying to someone. It's not defined by keeping secrets from them. It's not defined by having a marital issue that destroys the intimacy you've had. Offending means sexually abusing someone without their permission. And whether that's rape or a violent act, or it's a passive act like exhibitionism or voyeurism, those are forms of offending. So once someone approaches me for sex and I say no, if they force me to or talk me into it, or that's all offending. So the fact that I may look at a lot of porn and not be sexually available to my partner, and I lie and keep secrets, and I'm a general addict, does not make me offender. And the reason I say this so strongly is there are some people in the field who have really demonized sex addicts beyond their own problems and call them names like offender, which I don't. Believe me, offenders need to be called offenders. I was just having those. I was just at a conference where I was speaking about how to deal with offenders in the legal profession because I do expert witness and explanation for those folks around offending. So I'm well aware of what it is, and I'm well aware of what it's not. So I just feel really strongly about that. So I just wanted to say that that is not a word that I believe applies in our situation. Um, Second of all, what I am really struck by is I'm a long-term time porn user, and I have erectile dysfunction. Well, what I would wonder about is a couple things. Number one, do you have an erection when you're masturbating to porn? Because if you have an erection or you get aroused in that way, then you probably could have an erection with your partner, and that would not be considered erectile dysfunction. Might be other things, but it's not erectile dysfunction. And secondly, if you're looking at porn all the time, using all porn all the time, and you've been using it for decades, at any age, you're going to have problems getting erections and being aroused. Porn is considered something we call a hyperstimulant, which means it's not something that exists in nature. Other hyper stimulants might be cocaine. You know, cocaine doesn't exist naturally in nature. Cocoa leaves do. Um, what else? Sugar in its current form, refined sugar, doesn't exist in nature, but you can chew on sugar cane and you'll get some sugar. So what happens is when we use technology to escalate the intensity of something beyond what human beings are really made for, it has all kinds of effects. And one of the effects can be addiction, but a related effect is I just don't get turned on by a relationship sex or even dating sex because I'm so used to this hyper stimulation. I don't like a cup of coffee. I want cocaine. You know, it's the same kind of thing. So when you are used to stimulating yourself with such a high level of arousal, you are going to have erectile dysfunction and lack of interest in a partner, period. And then when you add to the fact that we already have intimacy problems, and you could think of sex and porn addiction as intimacy disorders, it even makes it more difficult for us to emotionally and sexually bond with our partners. So I think you have the whole thing bass backwards. You know, I think you need to stop looking at porn and work on yourself and become emotionally and physically available, and then see how things are with your partner. Because what this sounds like to me is an excuse. It sounds like an excuse to keep doing what you want to keep doing And no, your wife does not have to accept this. You may not be an offender, but she doesn't have to accept any of this. And yeah, she can say, I'm not putting up with this unless you work on yourself. Healing means all kinds of things. It's kind of like saying, I hit you all the time. And you're saying, well, will you still accept me and love me if I continue to hit you? It's like, well, no, I am not going to accept that. And what is acceptable or not acceptable to a partner is up to them, not us, up to us to say, you should accept this or you shouldn't accept this. And if she doesn't like it, she doesn't like it. And the question is, what are you willing to do to make your relationship? Do you just want to get away with whatever you want, or do you want a happy relationship? So, Tammy, I don't know if it seems like I covered a whole bunch of stuff there. Is there anything that you want to add? Or
Well, you did, and I was thinking, we've had guys over the age of 80 come to treatment because they didn't want to leave things like that, and I really feel sorry for your partner, because in addiction, it's me, 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 me. I want to do what I want to do, and wow, how disconnected you are from any kind of relationship or any kind of connection, with your significant person in your life. So I hope your partner has very good boundaries, has a very rich life, that isn't just focused on watching porn, or, the very small little, intensity, but really disconnected from any kind of real life. And I'm sad for you because you are missing out, on what, you know, the Dr. App says all the time, the opposite of addiction is healthy attachment, and the connection is what's really meaningful. When you die, you can't take the porn with you, but wow, having memories, having people remember you and care about
Mhm.
you, your porn won't care. Your porn doesn't care at all. So it's not real. So
And I would tell you, Tammy touched on this, but as I get older, I'm very important to me that I like the person that I see in the mirror. When I wake up in the morning, that I have good self-esteem, that I know I've been honest and kind, and that I'm trying to be the best person I can. And you are making a choice to not be the best person you can. And as I age, that makes it harder and harder for me to look in the mirror and feel good about myself. And if you're older, you know what we don't know what our expiration date is, but it's coming. And who do you want to be? How do you want people to think of you? Do you want your wife to think of you as, oh, he was just completely ignored me and totally focused on the porn, and our marriage didn't go like I thought it should have? And by the way, if you are doing well physically, and your wife is feeling ignored and unappreciated, and like you don't give a poop about her and all that stuff, when you are walking around in diapers and have a cane or a walker, who's going to take care of you? Do you think this woman or man is going to be so motivated to want to love on you and take care of you and nurture you when you have been treating them like they don't really matter? And by the way, I'll say the last thing. This is a great question. You can make love to your partner without having an erection. You can hold them, you can massage them, you can bathe them, you can arouse them. There are many different things that you can do, whether you can get erections or not. And so just because you may not be able to have penetrative sex that is what you would want, doesn't mean that your partner doesn't deserve your pleasure and your focus and to enjoy themselves with you. So basically everything I see here is wrong. And it just sounds like a total addict saying, well, it isn't my life isn't working out, so why can't I just drink? Because life isn't good anyway, and so who cares? I'll just be drunk all the time. That is what I hear here, and I don't think that works for alcoholics. I'm not sure it's a good choice for you either. But it's a great question.
it is, but again, you have the opportunity to change, but you have to be willing to do the work, not just throw in the towel. So, okay, Dr. Rob, the next question. What is intimacy anorexia versus betrayal trauma?
Well, I think these are on some level completely different things, but there is a relationship. So, just for me, I don't like the word anorexia applied to sex because I believe that that is documented to apply to people with eating disorders. So I think of it as someone who avoids intimacy, or if you want to say intimacy avoidant. I just think we have, the research and the information that we use as therapists, anorexia is something very specific meaning in eating disorders. So just want to say that as a general thing. But people to avoid intimacy can do it for all kinds of reasons. It could be abuse that I suffered when I was younger. It could be because I find sex uncomfortable and I've never been able to really enjoy it. It could be because I have issues around my religious upbringing or my beliefs about sex that leave me wanting to avoid it. It's interesting because you said intimacy avoidance. And I don't know what that means. Does that mean that you don't want to be close to someone? You don't want to be physically held by them? You don't want to have sex with them? Because intimacy, a lot of the people that I work with say, oh, intimacy, that's sex. And intimacy, sex is the result, the outcome of a lot of intimacy. And you could say that sex is one of the most meaningful forms of intimacy, or it can mean absolutely nothing. So I'm curious what you mean by intimacy avoidance, because to me, it isn't just avoiding sex. It's avoiding hand holding. It's avoiding cuddling up. It's avoiding making somebody, telling secrets and all the little things that make you intimate with someone. By the way, you might look up the word intimacy. I don't believe it says sex. Um, Now, betrayal trauma is something else. It's the experience of incredible loss and and grief that the life you thought you had and the person you thought you were with is not true. And people who go through betrayal trauma have PTSD, they ruminate, they have psychological symptoms. Betrayal trauma is a really kind of specific way of talking about PTSD because it really is a post-traumatic stress disorder. It has to do with these things happen to you. And now you're looking around saying, when are they going to happen again? And one minute you're angry, and one minute you're sad, and you can't sleep, and you're thinking about it all the time. And those are very typical symptoms of PTSD. And so betrayal trauma is a kind of specific way of saying, you're carrying around a tremendous amount of pain and struggle related to what happened to you. Now, of course, if you have been betrayed, you're not going to want to be particularly intimate with that person. You may not want to be intimate with anyone. You may want to kind of curl up in your own little shell and be on your own, or just be with the people who can support you. And so I would probably avoid romantic intimacy if I had been betrayed and I felt unsafe. But when we really get into intimacy, I mean, I have really dear friends that I've had for decades, and I think they're incredibly intimate friends. We know everything about each other, but I'm not interested in them sexually. So I think there are ways in which you can enjoy intimacy, and it's very important to have other people around to support you at this time when you're going through trauma. But you may not want to have that or be anything like that with the person you're romantically involved with, and that makes sense. It's different that someone who generally avoids being close, whether that's physically or emotionally, because you can have that without betrayal trauma. But many people who have betrayal trauma are avoiding intimacy because it's just too painful.
Well, that was a lot, and as to tag on to what you were just saying with their primary relationship, because like you said, right now that's too painful. But that doesn't mean, like, I've been subbing in more on the betrayed partner groups because somebody has been unavailable, and and I'm like, these women are intimate. They're sharing details like you're talking about with your friends, so they are willing to share and be close to someone else. So they aren't avoidant. It just isn't safe in their primary relationship right now. So part of that is the healthy boundaries that we talk about too.
I'm just
Okay,
gonna have one
go
more
ahead.
thing because I always have one more
Sure.
thing to add, which is that um, intimacy doesn't always mean sweet and nice and wonderful. Intimacy can be fighting and really working things out and having a hard time with each other. It's very intimate to open up and to be honest and to talk about things that are difficult. That is also intimate. So intimacy isn't always, ice cream and candy. It's sometimes it can be very painful and difficult. But what intimacy is really about is making yourself vulnerable. It's about opening yourself up emotionally because that person might let you down. They might hurt you. They may not be there, but you're willing to risk that in order to open up. And when there's a connection there and they hear you, that is intimacy. This is a good moment for me to say something I haven't said in a while, which is, what is the opposite of love? And Tammy, you've heard me say, I haven't said this in a while. The opposite of love, and this really makes my clients feel better. The opposite of love is not hate. When you hate someone, you're still in the game. Love and hate are kind of two opposites of the same issue: passion, intensity, connection. The opposite of love is indifference. When you just, you don't really care what happens. You've thrown in the towel and they can stay or go, to me, when you have distanced yourself emotionally, that is really the end of sorry, that is really the opposite of love. Hate, you're still in the game. So anyway, I think that kind of goes with
I
that.
was thinking the exact same thing. I was going to quote you on that one. So good job. Okay. Next question.
Thank
As a
you.
betrayed partner, how can I tell if prodependence or trauma bond is operating? How can we know our decision making is healthy? I feel like we're getting some of these terms tonight. So can you clarify prodependence and trauma bond?
Yeah, I mean, to me, prodependence is simply looking at those of us who love troubled people and not saying there's anything wrong with us for doing that, and looking at all of our attempts to help them and save them and rescue them, whether they were effective or not, as coming from a loving place, rather than codependency, which is a little bit like, what's wrong with you for being with this person? Or why are you spending all this time focusing on them when you could be focusing on you? And I think, if someone I loved was in trouble, I would focus on them too, whether it was cancer or whether it was addiction. So I tend to be incredibly nurturing and generous with partners and loved ones because you've been through a rough time and you don't need anybody to say, well, look at all these terrible things you've done in relationship to this addict. If nothing else, I can say, well, you didn't do the best job, but let me help you. We can do better. But even if you didn't do the best job with trying to help this person, even if you became, and we hear this a lot, someone you never wanted to be because you're living with a crisis, it doesn't mean that you are a bad person or a troubled person or innately broken. It means well, I guess I said this earlier, there is nothing more painful for me, than watching someone I love suffer and knowing that there's nothing that I can do about it. And so I can get pretty crazy if I watch an addict drinking and using and making a mess of their lives. And I'm just watching the damn thing. And there's nothing I can do about it. It's very painful. And in an attempt to get out of that pain and help them, I'll do all kinds of things, positive or negative, but they come from love and caring. I think a trauma bond is different. It's when I'm bonded to a very broken person and I have no boundaries. So I'll just let them do whatever they want and they can use me and take advantage of me. I'm going to hide my anger. It's more important to me to stay deeply connected with them with no light in between us than it is to be intimate, which is to really work on a relationship. And to me, a trauma bond is almost like there's one person and not two. The word bond, they're kind of so tied up in each other that neither one, or if you're the person who's bonded, you're so bonded to that person that it's hard to get angry at them. It's hard to set boundaries with them. It's hard to see yourself stepping away from them because here's a good way to think about a trauma bond. You feel like you can't exist without them. You know that you don't have a separate sense of yourself without them, and that you are literally repeating the wounds of your childhood in relationship to this person who mirrors it or has something to do with it. And back to prodependence, maybe some of the crazy things we do when we try to love someone who's broken do harken back to our past. Maybe there are things we do that are directly related to our crazy past that we act out when someone in our life is in crisis. But that doesn't mean that it's necessarily something that has to be addressed or worked on, because as the person begins to get better, I might become less and I might find the ability to have more space in between us. But Tammy, you heard more lectures about trauma bonding than I can even imagine. And because Tammy worked with Dr. Carnes for a while, who wrote this book on trauma bonds. And so I'm curious, you know both models. What are your thoughts about this? When is someone making a healthy decision because they love someone, even if they're sacrificing themselves? And then when are they just repeating something because they can't create any error between the two?
That's a really good question. And I'm not 100% sure that there's a really good defining, difference. I think somebody who's willing to look at it
Mm,
from a prodependence model, here's a thought, is that they're going, oh, what I have been doing, you shared this before, wow, that was heroic what you did. And, I can appreciate why you're doing that. I wonder if we can come up with, a creative, another way to do it. And that person is more invested in, helping things get different, that they are willing to do that. To me, that feels more in the prodependence line. A trauma bond is, almost that they, like you said, they're so close together. And I was thinking about this with somebody that was sharing the other day, and they talked about, like it was almost like they couldn't get angry because, well, he experienced childhood trauma, so therefore, so like they were completely shut down from themselves. It wasn't that they were necessarily trying to look at how do I keep the house from burning down. It was like they weren't allowed to have an identity in the relationship. So, and I don't know if that's exactly accurate. I haven't read the Trauma Bonds book in ages, but
I have,
to me, I always feel like it's like you're handcuffed together versus I'm doing these things out of love and I'm trying everything I can. But trauma bonding to me is like I'm chained to this.
well, I think it's hard to explain, Tammy, and you did a great job, is because I don't think trauma bonding, I wouldn't use that word. I would say we bond with people who are about the same level of emotional functioning and psychological functioning. So I wrote in Prodependence, and Tammy, if you don't mind putting in the chat, I don't know if people have access
Mm,
to the book, but
I
it is
do. I
about
can do
a
that.
more loving approach to those of us who love troubled people. And so even the term trauma bonding to me sounds very negative. It sounds
Yes,
like I'm supposed to
pathologizing.
know better and I
Hmm.
shouldn't. And what's wrong with me that I bond with traumatically broken people? And here's how I look at it. And then there's a whole chapter on this in Prodependence. And I kind of like that. I thought of this. If you're an emotional two, and I've worked with lots of women who talk about this, if you're just kind of a mess, your life isn't together and you're struggling with your own addictions and your emotional instability and whatever. A lot of people that I know who are twos will say, "Oh, I just want to marry a seven." They've got their life together, they're calm, they're thoughtful, they'll help me be more stable, all that. I just want to meet a seven emotionally. And every time I've met someone who said they wanted to meet a seven, but they were a two or a three, they've looked at that seven and said, they're boring. They're not interesting to me. I say I want to be with someone who's very, very much like this, but when I'm with them, I'm kind of bored because that's not the norm that I grew up with and that I experienced. And if you're a seven, by the way, and you really kind of have your stuff together, maybe an eight, you're going to look at that person who's a two and kind of a mess, and you're going to say, way too much drama, way too much of a mess. I don't want to be with a two. And so it really is, I think it's not trauma. We're going to bond with people who have similar emotional challenges than we do. Now, I might bond with an addict because my emotional challenge is neglect. And I have always tried to get someone's attention when they neglected me, and the addict is always neglecting me. But both of those issues they're two issues, they're three issues, they're four issues. So I think we're going to bond with people who have similar challenges to ourselves in a different direction. We're not going to date or marry to the perfect person. We're going to be dating and marrying the people who are kind of like us. But I think this is a great thing. And I also wrote about it in Prodependence that if you are someone who's in a relationship and you have your challenges and you have your issues, and that other person also has their challenges and their issues together, the two of you, I think, can go further than you can go separately. I'm always going to grow more with a friend or a partner who is also in their process of growth, and we can learn from each other. So I don't think bonding to people who are challenging is a bad thing. I think when it's not acknowledged, when someone says, I'm fine, or why are you bugging me, or when they're not willing to open up, when they're not in their own healing, when they aren't in therapy or they're acting out as an addict, that's the person I don't want to be in a relationship with because, and I'll stop after this. I I need someone to own their part. I make lots of mistakes. I do things wrong. Lord knows Tammy and I have had our differences, but at the end, I say, you know what, this is my part, and I'm sorry for this part, and this is how I contributed, and I didn't do the best job. And Tammy's gonna say, well, me too, because here's the part that I acted out. That means we're both able to communicate beyond our challenges. And to me, that's bonding with someone who may have issues, but it's a good thing because we can both grow. However, if Tammy's an alcoholic mess, we can't be intimate. We can't work on that because the way to, so in answer to all of this, if you're working with someone, if you love someone who is really working on themselves and you're working on yourself, you're going to have a really healthy, growing relationship. If you bond with someone who's a mess and you're looking for more, you're not going to get anything out of that except a lot of unhappiness. So that's way beyond the question, but there you go, Tammy. Lots of Now here's the next one is for you to answer to start anyway.
Yeah, I read it and
Oh,
I have feelings. So, yes, my wife thinks I should tell our children why we are separated. I feel shame, and since they don't live at home, feel like what they don't know won't hurt them. So this is two separate things. First of all, no kid, even adults, wants to know about their parents' sex life. So to say we're struggling and I've got some work to do on myself and we've chosen to separate for this time, you know, we love you, we both love you. This has got nothing to do with you. Great. That's all good. But if it's penance and your wife wants you to they need to know everything you did to me, that I'll tell you, I hear it all the time. And partners mistakenly think that it will automatically make the children side with them. It should never. Putting children, triangulating them is bad, but it also divides the kids. Some of them will go each way. So now the whole family is a hot mess, and you don't need that, especially when you're trying to, if you are here, you are, I hope, trying to do some work on yourself. So that's the first part. Then the second part, and I've got a book. So Dr. Rob, I'm going to back up. But Dr. Rob did a podcast with Dr. Ken Adams about adult children of sex addicts. So I will put that link in, and there's a book too. I will put that in there, in the chat, so you can take a look at those too. I put prodependence in just a moment ago. But the next part of it, I was like, oh wow, typical addict. I feel shame, and since they don't live at home, what they don't know won't hurt them. And I'm thinking that was probably part of your pattern with the addiction, is like what your spouse didn't know,
Right.
Doesn't hurt her, and all of that type of. So it's really two different things. As part of working a program, of recovery and integrity, we need to take ownership of what we've done. And the I feel shame is, oh, poor me. And it's not looking at what we've done that has been hurtful to other people. So I'm going to really discount that second piece and say that's great stuff for you to work on with your recovery program. But with all due respect, your kids, the last thing your kids need is to be dumped on by, your relational stuff. It's only a concern to them as they, I'm sure, are reading even from a distance that there's, there's emotional issues, within the home front. So, Dr. Rob, what are your thoughts?
Yeah, I don't think it's any of their business. I mean, I do think that kids see everything, adult or young, and you need to acknowledge their reality. Your mom and I have been having some problems. It's like a stake in our relationship. We're really trying to pull ourselves apart, take a look at ourselves and make it better. And, we wanted to acknowledge that with you kids. So, when you're around us, that there's no secret that we're struggling. You need to acknowledge their reality. But in my mind, there's only one reason to tell kids, because you're pissed off and you want to hurt the other person. I'm so mad at you that I'm going to tell the kids everything you did. Well, that may make me feel better. I got it off my chest. And of course, kids are going to go, oh my God, I can't believe that. And how could they do that to you? And I'm so sorry. But that's not what kids are for. Kids are not there to make you feel better. Kids are not there to help understand your problems. They have their own lives when they're adults. You have to acknowledge. So if your wife is here, I would say, I don't think telling them is a good idea. It's none of their business. They'll never get it out of their head. I can't tell you, well, I want to say that I've worked with a lot of people who said that their kids now worry about who they date, who they marry, who they're going to be involved with, because now they have this lens, and you can't unlearn this. So now you've got them worried and them scared. And like Tammy said, we've had couples, and I can think of some, who've done an incredibly good job at their own healing and growing toward each other, and then their kids won't accept it. Well, I can't believe you want to be back with mom, or mom wants to be with you considering what you did. And then, like Tammy said, they start taking sides and getting in the middle. And you did that because you pulled them into your problems. This is not any of their concern, except to acknowledge that there are challenges and there are struggles, and what they feel and see is true. But as Tammy said, it's not your fault. It started long before you, and we're working it out. And by the way, I know these things have probably affected you in a negative way, and I want you to know that was never my intention. But that's about it. Go to a therapist, go to a 12-step meeting, talk to me and Tammy, but don't tell your children. It's not their job to take care of you or rescue you or take sides, or, it's not going to help them. What is in the best and highest service for your children? And I would say it isn't to trouble them with your deep and challenging troubles. That's not what a parent does with their children. Yeah, we can move on.
I have one more thing to say, because I wrote it down the other day. Someone said that they were telling their children that they were working on bettering themselves. And I said, I love that. And I wrote it down. We're working on, we've had some challenges. We're working on bettering ourselves. Perfect. I loved it. So, okay. Next question. Every time I let my mind wander, I have visions of my husband having sex with other people. Will this lessen? Will this be forever? I don't know if I'm staying or leaving, but these images feel like they will never go away. Any ways to stop this for betrayed partners?
Well, the problem here for us, Tam, is we don't know how long this person has been in
I'm
the
going to say this
situation
is
working on
early
it.
in the situation because, and I'm sorry that you have, you've had enough discovery so you know some details, or honestly, a lot of times it's like I'm making up things in my head that is, isn't even what happened, but suffice it to say that that it is problematic and is stuck in your head. It's when people find things, I hate it because they see this and then those visions really can't do get stuck. But we talk often about doing some trauma work, and trauma work on those kind of specific images can be very effective, and immediate. It isn't on the deeper, deep trauma, but like getting those images so that it, you'll feel it a little bit, but it won't be the whole, oh my gosh, I can't move because this is so debilitating. So EMDR can be very effective, for this type of work. It's very specific on, on certain things. And if you don't have a qualified professional to help, email me, Tammy, TAMI at seekingintegrity.com, and include where you're located, and I'll see if I can help you find somebody. But no, you don't have to be stuck with those images forever. There are things you can do, but unfortunately those intrusive thoughts will continue to happen, unfortunately, especially if you're triggered, or things come up. So
Hey, Tammy, I wanted to put some information for everyone. Do you think I should put that in the chat, or where's the best place for me
if
to
you put
put
it
that?
in the chat, make sure you click on the everyone and not hosts and panelists. You hit
Okay,
the
so
drop down. Yeah.
then I'm just sending it to you and me, right?
No, yeah, exactly. If you do hosts and
Okay.
panelists, then it's just us.
All right.
So,
So
but
I'm
if
going
you
to
do
click on
everyone,
everyone. All right. They've
yes.
made this better, actually. So what I did while Tammy was sharing was I did a little bit of research on what is PTSD, what is post-traumatic stress disorder, and what do those symptoms look like. So this is a long thing. You might want to copy it and take it for yourself. But one of the things that's on this list is it talks about flashbacks, re-experiencing the traumatic event as if it was happening now, avoiding places or situations that remind you of the trauma, um, negatively thinking about it. Oh, there's one I want to put up, ruminating. So anyway, my point is that these are classic symptoms of someone who's been in trauma, to run something through your head over and over again and not be able to put it out of your head. It is a form of trauma. It is an expression of trauma. I think, and trauma simply means, what's a good word name for trauma, Tammy? I want a different word because we use that so often. Brokenness. It's a
Okay.
sign that you've been broken like a plate and you're having trouble putting yourself back together. And there are all these different pieces you can't stop thinking about. You're not sleeping, you're losing weight. All of those are broken pieces of the plate that have to be glued back together. And I'd say the trauma, for a good maybe metaphor, is something that's broken and you're having trouble putting it back together. I think every spouse has this going through their head. By the way, when we do disclosure, and I want all of you spouses to hear this clearly, we do not go through sexual details, and we don't want you to ask because we're not going to answer them. So when you say how large was their hoo-ha, or what kind of sex did you have, or what did their body look like, or we're not going to tell you that because you'll never get it out of your head. And so to tell you the details, which I know every partner wants to know every detail, I understand that, but it also re-traumatizes you. So while someone in the beginning, this makes perfect sense, which is, all I can think about is them in this situation. Um, if someone you loved was in a car accident, I would think about that over and over again when the car hit them and what happened and who came to see them, the ambulance. And when we have trauma, we ruminate. We run things through our head over and over because we're trying to make sense out of them. But I would say give yourself some time. And the other answer is, if you want to deal with this, get in a support group. Tammy will tell you we run, I don't know, 6 or 8, well, at least 5 or 6 partners support groups. You can find them on seekingintegrity.com. They are free. Once you sit with a lot of other partners and you hear them say, oh my God, I can't even think about them without thinking about that other person. Or every time I see them naked, you'll find out you're not alone. And I think it's incredibly comforting because we feel crazy. How come I can't get this out of my head? The other thing, by the way, I wanted to say is, where is this question now? Why Well, every time I let my mind wander, I hope that you're not having sex with this person. I hope that you're maybe not even sleeping in the same bed with them. You want to distance yourself from the trauma and the person who created it. You can't just be best friends right now. Your friends need to be people who can support you and understand what you're going through. So getting support, understanding that this is normal and healthy, part of trauma, going to see a trauma therapist, and as Tammy's saying, doing EMDR or other specific kinds of therapies. These are the things that make it better. And time will make it easier. It can take up to a year for somebody to get this out of their head in the way you're talking about. So be patient with yourself.
So the next question, my struggle seems a bit unique. I read it, it's not. I think in that while I don't have obsessive thoughts or behaviors associated with sex, I experience a pattern of dual addiction approximately one time every 6 months where stimulants and sex combine into a pretty nasty 1 to 2 weeks. My question is, how can I track the triggers to this behavior when it seems so far between the event? I'm hoping to curtail this from happening again, but identifying the vulnerabilities and triggers before they happen has been an ongoing struggle.
This is a lot of words because I was like confused at what they're saying, but I think what they're saying is, how can I anticipate that something's going on, and when that happens, that it's likely to lead to acting out? I think, is that what they're saying? How can I track triggers?
Yes, but it's happening once every. So I was going, this is a cycle of addiction, and sometimes this cycle of addiction is every day, and sometimes it's once every 6 months. So to me, it feels like you're in a pressure cooker, and it just keeps. So the first trigger probably starts right after you stop the 1 to 2 weeks of acting out, and then you go, oh, I'm not going to do that. I'm not going to do that again, and then shame and whatever else, and then So the bottom line, what I hear is someone who doesn't have enough support and enough program and enough work, under them, and are just going like, oh, I'm going to try to avoid the triggers and make sure that this doesn't happen in 6 months. And then it does. So to me, you are not terminally unique. This is just your pattern, and getting help, 12-step or drop-in groups. We've got the Sex Addiction 101 work group. That's a live facilitated group where you get a 3-circle plan, and you're really working on how do I identify, oh, I'm in that middle circle. Well, that's important information. That starts again November 18th. So there's lots of things to support you, just looking to identify what the triggers could be. There's probably bunches of them. So thoughts, Dr. Rob?
Well, I first want to answer the question really quickly, and then I need to go back into some things that seem pretty serious to me in this particular paragraph. You may never know what triggers you. To this day, 30 years into recovery and 20-something years in therapy, I can be doing whatever and all of a sudden think, oh, do I have an hour? I really want to go. Now, I can now, after a lot of work, begin to identify, usually after I want to act out. And how do I identify it? Because I know I want to act out. I do not know anyone who's been able to say, oh, I'm feeling a little abandoned by a friend who didn't show up for dinner, and I probably think in about an hour I'm going to want to act out. That's not how we operate. We operate from, oh, I feel like acting out. And then the bad idea is to say, I wonder why. What's going on there? I want to act out. I wonder if it was this person not showing up for me. It doesn't matter. What matters is if you feel like acting out, you go get help. You reach out. You go to a meeting. You talk to your therapist. You get help, because what matters is that you don't act out. Later on, figure out what it means. Maybe you'll know. Maybe you won't. It doesn't. You may never know what triggers you. But when you are triggered, that's what's important. What do I do? Not say, not think, not write in a journal. How do I connect with another person, which is always the best choice, to give myself the support to not do this. So I can tell you, and I say this a lot, I could show you a film reel of everything that ever happened in your life, ever, 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 if we had enough time. And you could say, oh, well, there was abandonment and there was abuse. And now I understand why I want to act out when I experience abandonment and abuse. It's not going to get you sober. It's not going to stop the behavior. Insight doesn't offer you a whole lot. Insight in and of itself is not what, if insight worked, everyone who went through a little bit of therapy would stop drinking or stop acting out. We need a much more active process that happens when we begin to think that we want to do it. And again, as I said, you may never figure out why. For some things, actually, it took me years to figure out why, but and when people come to treatment, the first thing they want to know at Seeking Integrity, well, I'm really here because I want to understand why. Why do I have these problems and why do I do these things? And I'm like, I don't care. You're asking the wrong question. The question is how? How do I find a way through this? How do I make better decisions? How do I know when I'm in trouble what to do? That's what matters. So take your head out of the past and put it in the present and make a plan for next time I feel like acting out. What am I going to do? And how am I going to do it? And where am I going to do it? Now, the other part I want to tell you is you should be in our treatment program. You should get on a plane or wherever it is and come out to California, because one of our expertise, not all of them, but not all of it, but about half our expertise is for people who have problems with drugs and sex or alcohol and sex. And what I see you saying is, I experience a pattern of dual addiction where stimulants and sex, and I'm assuming that means meth, combine into a pretty nasty couple of weeks. Well, you're not just addicted to sex and you're addicted to a whole process. And by the way, meth, it is, I don't know if nicotine is above it or nicotine is below, but they are the number 1 and 2 most addictive experiences. It doesn't matter what happened to you. It doesn't matter why you're having a bad day. When I'm in that place as a drug addict, all I want to do is use. And all I want to do is go have sex. And I can't think about anything else because that's the only thing on my mind. So I think and the reason I said you need to come out and see us is because I'm deeply concerned for you. I think people underestimate what meth can do to them. And by the way, if you're in any way over 40, people have heart attacks, people have strokes. It's not like you were 25. So I think there's a lot of things that I'm very concerned about here. And I hope that, you maybe call for a consultation session with me, with Tammy or one of the folks here, or just someone needs to really explore with you how troubled you are and how sick you are related to the drugs and the sex. And what is a pretty nasty couple of weeks? Are you acting out for 2 weeks? Or you do it once and then you just feel awful for 2 weeks? I think you need a lot more explanation. And did you say anything about 12-step programs or even therapy here, Tammy? Okay, so I'll say this and then we need to move on. You cannot do this by yourself. You cannot do it. I love our drop-in groups, but when you have a sex and drug problem, going to a drop-in group 1 or twice a week and talking to people, that's not it. You need to be in a very regular, very dedicated program of recovery. And that usually means an individual therapist, group therapy, going to lots of 12-step meetings, and or putting yourself in a safe place where you just can't do those things. And you might just discover during treatment part of why you do this. It's a good thing to know. It makes it easier to not hate yourself. Makes it easier to not say a lot of people I work with say I'm a terrible person, I'm a bad person. How could I do these things? I'm not worthy of. Well, no, you're broken. You're a broken person. And knowing that you have difficulty in the past that leads to you wanting to act out, that can help us hate ourselves less. But it doesn't stop the problem. So you need more help. I hope you get it.
I do too, because
And do keep
it's
coming.
really scary. Yeah, it's really scary stuff. Yeah, and it's easy to minimize. Well, it only happens once every 6 months, but that kind of behavior is, unfortunately, we know too many people who truly don't live, to the next one. So, it's scary, high risk behavior. So,
Right.
okay. The next one, if we go through a program, how can I possibly have my husband in my bed when his sexual profile says he's powerless to control his issue? Do I keep having to deal with his recurring behavior and my recurring PTSD? I know a little bit about this one. What is meant by that powerless to control his issue is there was a small assessment. I believe I think I've got the right person. But there was a small assessment that said he's powerless. And to me, that is, step one. I'm powerless over my addiction and I need help. And that would be a really good, place to start. But every partner struggles with this, is like, so if someone goes through a program and they actually do the work and they change, then there is hope. Whether you have him in your bed or not is up to you, and that would be part of the boundaries, and when is he, trustworthy? When are you willing to have, that kind of connection, and trust? As for how do you handle your PTSD, it's healthy boundaries. We just talked a little bit ago about, getting help and support, whether it's EMDR, somatic experience, doing the drop-in groups with other partners. We have a
Betrayed
betrayed
partners group.
partner. Yeah, the betrayed partner work group starts November 2nd. That talks about healthy boundaries. What is sex addiction? What isn't? What is it? It isn't, as well. So it really helps, programmatically, identify some of those issues. But, you can get help for you. And we have all the time. We've got testimonials on our website. I break out in tears when some of these guys write about how they change. I do. Like I did the alumni group, a while back, and like I kept tearing up because they're talking about how they have changed and they recognize, that they've hurt their partner, with their behaviors, and that they're working on being a different person. And it's not magically they're all going to be all better, but they have a chance, at doing that. So it's always caution, but trust is rebuilt. Dr. Rob says this all the time. Trust is rebuilt over time. So it's going to take time, but it takes action, him doing things differently for you to start going like, oh, that is different. He's showing up differently. Okay. I'm going to give him a little grain of, of trust. Okay. Yeah, I mean, that's what relationships are. So Dr. Rob?
Well, first of all, I don't know what you mean by in your bed. Do you mean having sex with this person or simply lying next to them? I don't know what you mean by that. But powerlessness, it's antithetical. I looked this word up. It's a big fancy word for meaning the opposite of two things that don't make sense that they're opposite. So it doesn't, or that I'm sorry, it doesn't make sense that they go together. They seem like opposites. So the idea that I am powerless and acknowledging that helps me to stop, that's antithetical. Those things don't seem like they go together. If I'm powerless, then I'm going to keep doing it. It's a very important concept in recovery in a 12-step to acknowledge that you're out of control, that you can't fix this, you can't make it better, because it pushes us into needing help. If we think we can handle it, that we've got this, that we're going to make it better, that's sort of saying, well, I have control over this, a good word for power over this, and we don't. We are flawed, we are broken in such a way that we really need the support and direction of other people. So powerlessness is a good thing if he's willing or she's willing to accept it and say, yeah, I can't fix this, I need help, I need support, which the idea of powerlessness can drive us to. I don't know how long this relationship or these situations have been going on, but you don't have to deal with his recurrent behavior. If he's not dealing with it, or he or she has not stopped, is not doing things about it, they don't need to sleep in your bed at all. They don't need to be in your house at all. These are not, closeness is not a require. I don't need you to be close to me to get better. And I've heard this just in the addicts today. Is like, who do I turn to if I can't turn to my spouse? Anybody. 12-step recovery people, therapists. But and I don't know what you mean by going through a program, by the way. Please come see us. I'm glad to work with you, and you can reach out to Tammy if you want to get more information. And that is TAMI at seekingintegrity.com. I don't know that everybody knows that we run a treatment program, a residential treatment program that's 3 to 4 weeks long. I'm there, all the therapists are there, we are and you live with us. So, or we create a place for you to live. So there's no,
For men
oh
only.
gosh,
It's men
men
only.
only,
Yeah,
but it's not
14,
like, well,
21,
I'm
or
going,
28-day length of stay. So yes.
it's not like I'm going to therapy or going to a treatment thing and then I go to a hotel at night or I go home at night. We need people to focus on this 24/7. By the way, a person who has a drug and sex problem, they really need to focus on this 24/7 and have a safe place to be when the emotional stuff comes up that leads them to wanting to do drugs and acting out. To me, Tammy, I could be wrong, but this seems like a very early kind of question that someone who really hasn't had enough time to talk to peers to learn about recovery. I agree. I think the Betrayed Partners group would be very helpful. Let me say this also, if I haven't been clear. There are two kinds of groups that we do. There are probably 8 to 10 groups a week or more that are free. And we do this because we believe that that's a way we can serve people. We know there are so many people who will never be able to afford treatment, never be able to afford the time, or don't have, the money for therapy or whatever. And so we give a lot of it away, a lot. But we also have paid work groups where people who want to get the information they need, they can be in therapy, but they're getting the background information. It's a course. They're doing homework, they're learning stuff. And we do this for addicts, for partners, for couples. I mean, it's across the board because in therapy, you do a lot of work on yourself, but you don't necessarily get the education that you need. And when someone comes into our treatment center, one of the things we do, one of every center does, is a lot of education because we have time. But when you're with someone 1 hour a week, you're not necessarily going to get that. So we created paid courses so that you can, as a betrayed partner, meet other betrayed partners, get counseling from a betrayed partner, understand. Maybe that's a good way to say it. I think a lot of partners, and we've seen this today, Tammy, they don't know what's happening to them. They don't know why they're so overwhelmed. They don't know why they can't sleep at night. They don't know how to make themselves feel better or if this will ever get better. And I think that is one of the main purposes of the partners group, is the partners work group, is to understand that what's happening to you is normal. It's healthy. It's understandable because your whole life has been turned upside down. And then how do you make it better when you don't know whether the person you love is going to get better themselves? And I think that's another reason to, do your own work. So I don't know what you meant by if we go through a program, but I can say that powerlessness is an important thing. And yeah, if they are continuing to do this behavior and not getting better, you're going to continue to have PTSD, and you might need to take an action like saying, I don't want you home tonight, or I don't want you home for months, or whatever you need to do. So let's keep moving.
There are so many good questions in here. We need like 2 more hours. So the next
No,
question, Dr. Rob, is,
dinner.
I know. Why can my partner have sex with other people but experience erectile dysfunction with me?
Okay, so I'm going to do this very quickly. Part of our intimacy disorder. See, okay, if I'm in a relationship with you, I have a lot to risk. I could be emotionally harmed. You could bring up things from my past. I could turn to you and be open and vulnerable, and you might let me down or hurt me. It's scary for us to get close to people. And that's why we live a double life. Most of you spouses will say, and I know this for a fact, we don't always have the most intimate relationship. There's a lot of things we don't talk about. He won't talk about, she won't talk about. I invite them in and there's, I don't have time, or I don't want to talk about that anymore, or they stop us from that kind of intimacy because it scares them. And it's difficult for them. Um, I could I could have sex with pretty much anyone out there, but having sex with my partner takes being thoughtful, takes being present and trusting them and trusting myself. And when I go out there with a stranger, I don't have to worry about whether they like me or not. I don't have to worry about whether it's going to work out. I don't have the pressures that I do in trying to make a relationship work when I'm out there with a stranger. No sex worker is going to let me down, hurt me, disappoint me, or any of those things. So I think, first of all, your partner needs to stop having sex with other people, or they will experience erectile dysfunction with you. But I think there's a whole bunch of other emotional issues on the table that the two of you might need to work on together, but not until he or she stops acting out. So let's keep running ahead and get to as many as we can.
Okay. The next one is a two-parter. It's long. So I feel confused about how to distinguish between what parts of my SAPA's behavior are a condition of his addiction and which parts are simply a matter of compromised sense of character and morality in general. When we first dated almost 10 years ago, I asked him if he was ever unfaithful to anyone. His answer was a lie, and he proceeded with a long courtship, all the while knowing from the start that the biggest priority to me was his honesty. While I still feel love for him, it's hard for me to consider reconciling with him, even if he does all the necessary work to recover, because to do so feels like I'm betraying myself to even consider being with a person who lied to me from the very beginning. And it's continued. He has taken 3 of our SI classes, but no 12-step yet, intends to, no full disclosure yet, she's in Kristen Snowden's
I love
class and in
Preston.
therapy, and we're both looking for CSATs and formal therapeutic disclosure. The intends to is like a huge deal breaker for me in addiction. It's like intends. I can sit here and tell you I intend to do all that, but I'm not showing you that I'm willing to do anything. So all I hear so far is lip service, like, oh, I'm not going to lie anymore, but he's not doing anything. So I mean, I say this all the time. I love our work groups. I love them. And I always say, and they're not enough. People call and want the quick little, oh, I just want to do an online. I don't want to really do the work. So they'll take the online work groups. They're a great foundation, but that means and 12-step and our drop-in groups and working with a qualified professional. If you do a whole bunch of things on a daily basis and really start having accountability and changing, then there's hope. But all I hear is I did 3 work groups, which is 18 weeks at an hour and a half up a night, and that's supposed to change decades of of problematic behavior. So I'm glad you're working with Kristen, but until and unless he gets his poop together and really starts working on a program, I wouldn't do a formal therapeutic disclosure until both of you have a qualified professional and he's really done some work. Another one that could really benefit from our residential treatment program. So, Dr. Rob?
Well, every addict by nature we are broken.
Mhm.
Our character and our sense of morality shifts depending on the situation we're in. And when I'm dating someone and I want them to marry me, I am not going to tell you the bad things about me. I'm not going to tell you about my dishonesty. I'm not going to tell you about my acting out because I want you to be with me. And my fear is that if I tell you, then you won't want to be with me. And this is so destructive to partners because we think, well, as long as they don't know, they want to be with us. And we don't realize that they're going to find out at some point, and this exact thing is going to come up, which is, I thought you were an honest person. I thought you had integrity. Who am I married to? What is this all about? It doesn't matter to us whether your priority is honesty. Our priority is getting what we want. And we will figure out to manipulate, whatever it takes to get you in our lives. And then whatever it takes to keep you in our lives. We don't want you angry at us. We don't want you upset with us. We don't want you leaving us. So we will continue to lie because it is in our own it's self-serving. I am afraid if I get close to you and I tell you the real truth, which is incredibly vulnerable, by the way, you're going to leave. That's really the bottom line. And so I'm going to lie to you. And also, I want to have my cake and eat it too. I want to go act out and I don't want to get in trouble with you. I want to be able to do whatever I want to do. All of these things are typical signs of being an addict. I also believe as an addict that I am worthy of love and that I can clean up my messes. And one of the things that I always said to clients who were coming to treatment with me in the beginning is, I know you're going to lie to me. You lie to everybody. But what I ask of you is, within a couple of days, you leave me a message on my work phone machine that says I lied to you. I just want to know. You don't have to tell me in that moment. So I think there are ways, let me say it this way. You married who you married. And there is more here with this person in your life together after all these years than their challenges with addiction. And part of what goes with addiction is lying and keeping secrets. So you've been with someone who lies and keeps secrets your entire relationship. Do you want to throw out the relationship because they have lied about these things? They lied because they're broken. They lied because there's something wrong with them. These are not moral issues. And one of the things Dr. Carnes, one of my mentors, would say is that take an addict and get them sober, and you'll find that many of us have very intact ethical and moral belief systems. It's just that the addiction was more important. And it's easier to see when someone's drinking. It's much easier to see, how could they drive drunk? What an awful person who could, knows what they would do. But they're not thinking about that. They're thinking about, gee, I've had a few drinks and I want to get home. So, and that's what I want. So, I think it is not correct to say that we're not moral people, I think that there is intact morality in many of us, and we don't mean to let you down and hurt you, but we deny that reality to ourselves as well as to you. Um, I think the hardest thing for spouses, and I hear this a lot, Tammy, is, if you told me at the beginning, I would have worked on this for you. I would have helped you. Like the porn actually, if I knew you had a porn problem when we started or 10 years ago, we could have worked on it together. But now finding about all about this and not knowing that it was all going on for whatever many years, that's incredibly painful. Because on some level, what I'm really saying to you is I don't trust you. I don't trust you enough to let you in, and I want to do what I want to do, and all of that. So, no, yes, addicts have compromised character and morality in general, but that doesn't mean that when we are truly working on ourselves to be better people, that those things can't be regained or gained in a healthy way. Um, and I do know people that I've worked with who lack healthy character and don't have morality, but they're pretty few and far between over the years. Tammy?
I have one that I'm going to ask you because it kind of tags on to something else. So I'm a spouse with grown children who, this is from 533, who have been told I'm crazy by my husband, and I'd like my children to know it was not me. So your answer to anonymous bothers me for my kids in their 30s who should know that I wasn't crazy, but who might also get information about not getting mired in porn. So I hear the fear, from a mother, but I, I still hold to you running off and saying, well, he's a sex. I mean, it doesn't help the kids. And
Right.
I don't know anybody who goes, I'm going to tell you all about porn addiction so that you don't become one. Actually, it can create more fear. You're a good mom. Like they will know that you're not crazy. You showing up as a good mom to them and letting some of that stuff, run off is how you show up. You support them. You be who you need to be for them. And kids, it's amazing to me how they figure out, oh, that doesn't ring true. They can feel through those lies. So I would encourage you, rather than triangulating your kids, be the non-crazy mom that you are, because you telling them is just, I'm concerned that it's
Then you
hurtful.
become
There's a
more
book.
of the problem. Then you're
Yeah,
even more of a problem.
yeah, yeah.
Here's what I would suggest is, and this is a perfect example of being vulnerable. I would get my kids and I would say, Dad are having a lot of problems, and Dad's been blaming me a lot for them. And I'm afraid that you're going to see me as the problem. And I just want you to know that we have issues, but we share them. And I'm afraid that you're going to back away from me because your dad's going to ask you to pick sides. And, in other words, you can say all of that, which is incredibly vulnerable and open, your fears, your concerns, your love for them, the nature of what's happening between, if he tells you this, that's going to happen. You can tell them all of that without talking about sex addiction. And quite honestly, the other part is your kids are in their 30s. It is too late for you to help them with their emotional problems. That was at 16, 15, 12, and 9. They're adults. If they have a problem, they can go get help. If your husband, as a recovering person, wants to come back and say, I had some addiction problems and I do want you to know they run in the family, doesn't have to say what it is. And I'm just concerned about you. What kind of addiction, Dad? I don't want to talk about the details of what I struggle with. I just want to let you know. But your husband's not in that place, not at all. And so and I just love Tammy. Um, my goal is not my job is not to make my kids love me more. My job is not to make sure that they're feeling intact love for me. My job is to take care of them and be there for them the rest of my life. And if I can say to them, I know this might be confusing for you and it's confusing for me, then I'm comforting them. Then I'm helping them understand reality. But pulling them into the middle of this is that's not being a good parent in my mind. No offense. You may want to do it, but addicts want to do a lot of things too. And sometimes how it feels in the moment is not the best idea. So here's the great, I'm so glad that you're here. I'm so glad you're asking these questions. They are the right questions. And I hope you go to some of the support groups because there are other spouses there who have partners, who have kids who are in these situations. And in fact, Tammy, we have a free group for women who are older, whose kids are grown and gone, so that they can talk about those situations. And we have a seat waiting for you in that group, and it costs nothing. So, hey, Tammy, good to see you. Appreciate your time as always.
Thank you. And
And
thanks for taking extra time to answer
of
that one. I just felt that
course,
was important.
of
So thanks
course,
to
good
everybody.
to see
Great
you.
questions. Lots of support on our website. So, if we can be of help, and honestly, some of you
Write us.
would really benefit from treatment, we're happy to help. So take care, everybody.